Good afternoon, Jack. I would like to thank you again for donating some of your time to discuss an ethical dilemma regarding one of my clients, Fen, and the potential resolution, consequences, and course of action that we are going to take. The current ethical dilemma is that Fen has presented with some eating challenges during our session, and due to my lack of experience with clients with disordered eating in the past, this is an ethical dilemma because she might not be receiving the best level of care needed for her health, despite having a strong therapeutic relationship with myself. The APS standards and principles applied to this ethical dilemma include APS code B.1.2, which states that psychologists only provide psychological services within the boundaries of their professional competence. And this is included but not restricted to working within the limits of their education, training, supervised experience, and professional experience, basing their service on the established knowledge of the discipline and profession of psychology, adhering to the APS code and guidelines, complying with the law of the jurisdiction in which they provide psychological services, and ensuring that their emotional, mental, and physical state does not impair their ability to provide a competent psychological service. The second, which is B.11, which pertains to termination of psychological services, particularly B.11.1, B.11.5, and B.11.6, state that psychologists can terminate services with a client if it is clear that they are not benefiting from the services provided. 11.3 states that psychologists will make reasonable arrangements for the continuity of service provision when they are no longer able to deliver the psychological service. And 11.5 states that when confronted with evidence or a problem or a situation which they are not competent with, or a client isn't benefiting from the services, psychologists will provide an explanation for termination, a means to safeguard the client's welfare after termination, and offer to help the client to access alternate assistance. And finally, 11.6 states that psychologists whose employment, health, or other factors influencing the early termination of relationships with clients will provide an explanation for those terminations, safeguarding their welfare, and offering assistance for accessing alternate assistance. The values trap and the effects on my decision-making include the personal relationships that I have with loved ones suffering from anxiety and depression, which may lead me to being hypersensitive to clients' needs or overall avoidance of the topic due to the salience of the subject matter. This may result in me wanting to help as much as I can due to personal reasons rather than for client benefit. I might also experience transference of my own experiences and interactions with those said loved ones onto my clients and project my own problems and worries rather than listening to the client. The rights and vulnerabilities as a psychologist that I have are that I need to understand the laws and requirements of the practice, state, and country when treating clients in an APS consistent manner. Secondly, respond to any situation after conducting thorough research, knowledge, and understanding of the relevant laws and policies, and to perform and administer the relevant psychological assessments at a high standard whilst behaving ethically under the APS code. A vulnerability that I have can be seen in B.11.6, which I've discussed before, which is that my health, welfare, employment, and other factors as a psychologist may result in early termination due to feeling numb thinking about what to do with my client Fen, which I've included in my notes. As a client, Fen has her rights labeled in A.3, the informed consent section of the APS code, particularly A.3.1 and A.3.2, which state that she has the right to me providing full disclosure regarding the psychological services I tend to provide unless there is an explicit exception agreed upon in advance, which is not possible to obtain informed consent, and that this informed consent and the findings that I will be presenting to her will be delivered in a plain language with no jargon. And her vulnerabilities are that discussions around disordered eating, due to this being newly brought up and have no previous record to my knowledge, may worsen anxiety and depressive symptoms, which she originally presented with at the start of our therapy. The possible decisions and resolutions. The first one is to gather a second opinion from a clinical supervisor or another colleague. Now, if that second opinion requires me to continue providing services to Fen, then I would be consulting with an expert or someone who is more qualified in the area of disordered eating, with informed consent of the client, of course. If she chooses not to, then we might need to resort to decision 2, which is the termination of psychological services and referral onto someone else who is more experienced in that field. The possible consequences for the decisions and resolutions I've just brought up is that the client's mental health and eating challenges may be exacerbated, and that may be due to a history of termination of psychological services, and therefore it's speculated that by terminating services with her now, she may see this as a chain of events and therefore may stop seeking psychological assistance in the future, and an overall decline in her mental health. And finally, if I do decide to continue service with her, this violates the ethical code of conduct due to the reasons I've stated above, but mainly because she is getting inadequate care from me due to my lack of experience and expertise. The final decision that I've chosen is to terminate continuation of psychological services with her despite having a strong therapeutic relationship. And I plan to do this by informing Fen on the reasoning behind this decision, which is because due to my lack of expertise on this decision and on this topic, she will not be benefiting from the full access of care she is entitled to. I would then ask her what she values about our therapeutic relationship, and as I am trying to make arrangements for her next psychologist or clinician, I would communicate those with that professional, and so that they be able to hopefully implement that moving forward. I would also research any specialists or psychologists on eating disorders, body image, and refer the client to access their psychological services. And these are the references used to guide the decision-making and assessment today. I'd like to thank you for listening to this presentation about the current ethical dilemmas, consequences, decisions, and resolutions regarding my client. Thank you.